sit back actually. Is that okay?
If you have to shuffle like 2 inches to your right.
I haven't rehearsed, honest.
All through my teens and especially my early 20s, I suffered with chronic anxiety, and it was debilitating, and it really interfered with my everyday life. There came a point where I had to seek help, essentially, and then I was diagnosed with bipolar and chronic anxiety.
I was not well enough to work and was at a place where I was actually suicidal.
The challenges I've always faced have been struggling to put on weight, and so that's been a challenge. Also the smoking, sometimes 60 a day. Smoking impacted my mental health in the sense that I didn't feel good about myself. So I did it because it was there, something to do with your fingers.
Well, to start with, I met my GP and he put me on various sorts of medication. It helped initially, and after a few years, we really needed to seek other answers because it was only doing so much.
Yes, giving up smoking was something my GP was particularly, I think, saw that as a particular issue for me because they felt it was densing my appetite. So they would suggest going to support groups, which I did attend. I attended quite a number of those over the years.
So I remember one of my GPs, she suggested I join a gym, and that piece of advice really helped with the social aspect of my anxiety.
So my GP was very open to me exploring other avenues in terms of treating depression. So I was very fortunate to have his support and to have his feedback and to have the dialogue of where we could explore other options, from vitamin deficiencies to holistic approaches. And it was an ongoing dialogue, and we'd have an appointment and we'd speak about it, and then we'd review in a couple of months' time.
I don't know if we're rolling, but I found that my friends were still there for me, I feel quite emotional talking about it now. They were all there. They hadn't abandoned me, which was one of my fears. My friends were still my friends, and they were concerned about me, and they just wanted Dan back.
Because my physical health is that much better, and it impacts on my mental health, so I'm able to deal with more difficult situations a lot better. So it's helped with my mental resilience.
I think people have a tendency to separate physical and mental health and even emotional health, and I strongly believe we need to treat them as one and the same because one impacts the other directly.